when we talk about morning wood, or what doctors call nocturnal pain, altumescence. It's more than just a sign of sexual readiness. It's actually one of the clearest indicators of a man's overall health. Every healthy man should experience spontaneous erections during sleep, especially in the early morning hours. These occur because the body cycles through phases of REM sleep, during which testosterone levels peak and blood flow to the pelvic region increases. When these erections start to fade or disappear, it's often a clue that something deeper is going on inside the body. Something affecting blood circulation, nerve sensitivity, or hormone balance. As a urologist, I always tell my patients that morning erections are like a natural status report from the body. They tell us whether the vascular system, the hormonal system, and the nervous system are communicating properly. If you're not waking up with an erection as often as you used to, it doesn't automatically mean something is wrong, but it does warrant attention. Factors like stress, anxiety, poor sleep, lack of exercise, or even subtle hormonal dips can make a big difference. The good news is that this is reversible when you focus on restoring your body's natural rhythm. Think about it this way: at night, your body is repairing itself, muscles regenerate, hormones rebalance, and blood vessels dilate more easily. When that process is disrupted, either from poor diet, alcohol, late night screen use, or sleep deprivation, it interferes with testosterone release and vascular function. Over time, that can blunt morning erections. It's not just about age, it's about how well your body is being supported to do what it's meant to do naturally. So, when people ask why a simple daily habit, like taking 1 tablespoon of a certain oil before bed, could have an impact, it's because we're leveraging the body's natural repair window. During sleep, when testosterone production is highest, the body needs the right building blocks, healthy fats, antioxidants, and minerals to sustain that hormonal and vascular balance. Morning wood isn't a random occurrence. It's your body's way of saying everything's working as it should. In essence, the presence or absence of morning erections isn't just about sexual health. It's about total health. It's the intersection of blood flow, hormone stability, and restorative sleep. By paying attention to it, you're not just improving one part of your life, you're giving yourself insight into how your body is aging, recovering, and responding to stress. And that's exactly where this simple nightly habit begins to make sense, because when you support the body's natural systems, it has a remarkable ability to restore itself. That's the message every man needs to hear. Your body already knows how to heal. Sometimes it just needs the right fuel and a little consistency to remind it how. When I talk about natural oils, I'm not handing out a miracle cure in a little bottle. I'm talking about real food-based tools that nudge the body back toward the physiology it already knows how to do. Certain oils are concentrated sources of the exact nutrients our vascular and hormonal systems need. Healthy unsaturated fats to build cell membranes, polyphenols and antioxidants to protect endothelium, and trace minerals that support enzyme systems involved in hormone synthesis. For example, pumpkin seed oil has been studied for prostate and urinary health, and appears to have compounds that support nitric-oxide pathways and reduce oxidative stress, both of which matter. Healthy blood flow. PMC plus 1 extra virgin olive oil is another one I recommend because its polyphenols have measurable effects on endothelial function. That's the lining of your blood vessels, and endothelial health is central to getting and maintaining strong morning erections. Laboratory and animal studies show components of olive oil help maintain nitric oxide availability and blunt inflammation in the vessels, which improves how easily blood can reach the penis during the nocturnal repair window. PubMed +1 black seed, also called Nigella sativa, shows promising effects in preclinical studies and some small human trials. There's evidence it can improve certain markers of reproductive function and may relax smooth muscle in the corpus cavernosum. In plain language, it can help the blood vessels there relax more readily. But most of the strongest findings are still early stage or from animal models, so I discuss it as promising rather than proven. ResearchGate +1 flaxseed and its oil are often talked about for hormones because of lignans and omega-3 precursors, but the clinical picture is mixed. Some studies show little to no consistent effect on testosterone in men. That's why when I counsel patients, I emphasize that not every healthy oil will move the needle for every man. The baseline diet, weight, sleep, and metabolic health all change the outcome. PMC +1 practically. Why take a tablespoon before bed? Nighttime is when testosterone pulses and vascular repair happen. Giving the body a small, easily absorbed dose of healthy fats and antioxidant-rich compounds at that time supplies substrates for hormone synthesis and protects the endothelium during its key repair phase. But, and this is important, these oils are adjuncts, not stand-alone therapies. They work best combined with sleep, hygiene, exercise, weight control, and medical review when needed. If you're on medications, have a chronic condition, or are uncertain, check with your clinician before starting any concentrated supplement. Small, consistent habits feed big system repairs. Give the body the right materials at the right time, and it will often do the rest. Now that we understand the biology and the nutrients that support it, let's talk about how to actually apply this knowledge, the part I like to call the 1 tablespoon before bed protocol. This isn't a gimmick or a quick fix. It's about creating a simple, sustainable nighttime habit that aligns with how your body naturally repairs and restores itself while you sleep. The reason this specific timing matters is that your body's hormonal rhythm peaks overnight. Testosterone production surges, growth hormone releases, and your vascular system undergoes active repair. By taking in a tablespoon of nutrient-rich oil right before bed, you're giving your body exactly what it needs to optimize those nighttime processes. When you take that tablespoon, whether it's pumpkin seed oil, olive oil, or black seed oil, you're feeding your blood vessels the right kind of fuel. These oils are loaded with omega-3 and omega-6 fatty acids, vitamin E, zinc, and natural antioxidants that support the production of nitric oxide, which helps your blood vessels relax and open. Over time, this can enhance blood flow not only to the heart and brain, but also to the penile tissue. That improved circulation during sleep is what sets the stage for stronger, more consistent morning erections, your body's way of saying, "Thank you, I'm working again." Now, here's what most people overlook. It's not just the oil that makes the difference. It's the environment you create around that nightly routine. You can't take 1 tablespoon of oil and expect it to overpower late night scrolling, 4 hours of sleep, and high stress. If you pair this with the right sleep hygiene, dimming the lights, putting your phone away 30 minutes before bed, maybe taking a few deep breaths, you're signaling your body that it's time to recover. That's when the oils can do their work most effectively. Another important aspect is consistency. The benefits come from steady use, not 1 or 2 nights of trying. Think of this as part of your nightly ritual, just like brushing your teeth. Over a few weeks, many men notice subtle changes. Better sleep quality, improved energy in the morning, and eventually the return of natural morning erections. That's not magic. That's physiology responding to regular care. And yes, moderation matters. 1 tablespoon is enough. More doesn't mean better. Too much oil can interfere with digestion or calorie balance. This small dose gives your body the healthy fats it needs without overwhelming your system. Combine that with good hydration, a diet low in processed sugar, and light exercise, and you've created a foundation your hormones can thrive on. So, the 1 tablespoon before bed routine isn't about chasing results overnight. It's about working with your biology, not against it. When you support your body's natural nighttime rhythm, it pays you back in energy, confidence, and vitality by morning. When patients come into my office and ask how they can get their morning back, the conversation often goes far deeper than just restoring erections. It's really about restoring confidence, balance, and vitality. That's why, from a urologist's perspective, this entire approach, using something as simple as a tablespoon of healthy oil before bed, is not about chasing virility. It's about supporting overall male health through natural means. For too long, men have been taught to separate sexual health from total health. They see erectile issues as something isolated, something to be fixed with a quick pill rather than a signal from the body. But what we've learned through years of research and patient experience is that sexual performance is a mirror of cardiovascular, hormonal, and even psychological well-being. When a man's morning erections start to fade, his body is often whispering before it starts to shout. It might be an early warning sign of poor circulation, insulin resistance, sleep apnea, or hormonal imbalance. Addressing it naturally, early, and holistically can often prevent the need for stronger medical intervention later. That's where lifestyle medicine and urology now intersect. We're no longer limited to only prescribing pills or procedures. We're helping men reconnect with their own physiology. Healthy fats from oils like olive, pumpkin seed, or black seed aren't treatments in the pharmaceutical sense, but they do nurture the body's own repair systems. They calm inflammation, enhance endothelial function, and support testosterone stability, all critical elements for sexual and cardiovascular health. When combined with daily movement, stress reduction, and proper sleep, these habits act synergistically. One of the most powerful changes I see is psychological. As men start implementing these small, intentional habits, maybe taking that tablespoon of oil before bed, walking after dinner, or prioritizing 7 hours of sleep, they begin to feel a sense of control again. That shift in mindset is huge. Confidence starts to return not because of a supplement, but because they've taken ownership of their health. They're no longer waiting for a prescription to solve everything. They're participating in their own recovery. And let's be clear, this doesn't mean we reject medical solutions when they're needed. Urologists are here to help identify underlying issues, guide safe supplementation, and ensure there's no hidden cause being missed. But what excites me most is seeing men combine the best of both worlds, science and self-care, because when you bring those together, the body responds beautifully. At the end of the day, the goal isn't just to restore morning erections, it's to restore what they represent: vitality, energy, and a quiet confidence that comes from knowing your body is functioning the way it's supposed to, and that's something every man deserves to feel naturally, consistently, and powerfully.